Welcome everybody, Your Excellencies, Prime Minister, Honourable friends and partners. I'm Eloise Todd, Executive Director of the Pandemic Action Network, and it's a great pleasure to welcome you here today in person. An achievement in itself. On behalf of the Independent Panel for Pandemic Preparedness and Response, Pandemic Action Network, and in partnership with the New Zealand Government, to our session, Required Political Leadership to Pandemic-Proof the World. We collectively called this meeting to sound the alarm on the need for more international, coordinated leadership on pandemics to end that pernicious cycle of panic and neglect that has haunted us for decades now. We will also hear examples of inspiring national leadership to help inspire us to make that second move to the international level. The current context is that there's been a lot of action internationally. The Independent Panel report that came out in May 2021 and the follow-up in May this year made many recommendations, some of which have been taken forward, but not as a whole coordinated package. We have seen the Pandemic Fund launched. We've got a process to negotiate a new pandemic legal instrument. The UN General Assembly has agreed to hold a high-level meeting in pandemic preparedness and response. But all of this activity is disaggregated, needs pulling together. There has been this lack of coordinated international leadership to do the job, and that's why we're here today. In our first panel, we'll hear from two extraordinary leaders, the Right Honourable Jacinda Ardern, Prime Minister of New Zealand, and shortly to arrive, Her Excellency Ellen Sirleaf, former President of Liberia. Both these leaders met the moment when pandemic threats hit their shores. We're humbled to have you here. Thank you so much. Our second panel will look at solutions for now and in future with another fantastic lineup. The Right Honourable David Miliband, Dr. Ayoade Alakija, and Dr. Raj Panjabi, who I'll introduce properly later. They will talk about potential solutions to this lack of leadership, including something a bit like potentially a Global Health Threats Council, as discussed in the Independent Panel report, a council at the very highest political level to get and galvanize that political leadership we need. This is an idea that the Pandemic Action Network strongly supports, and we'd love to see leaders and advocates in this room get behind. Throughout our event today, we encourage you to engage on Twitter using the hashtag #PandemicProof. And please, while you've got your phones out, ensure they're on silent. Thank you so much. It now gives me great pleasure to hand over for our first discussion. And moderating our events today is the incomparable Right Honourable Helen Clark, former Prime Minister of New Zealand, co-chair of the Independent Panel with President Sirleaf, former Administrator of UNDP and current board chair of the Partnership for Maternal, Newborn and Child Health, to name but a few of her hats. We'll be talking and hearing about how these leaders got stuck in, rolled up their sleeves, and shows why leadership matters when it comes to pandemic response. Thank you so much, and please come up to the floor.
Well, thank you, Eloise, Prime Minister Jacinda, Excellencies, and everyone who's come for this very, very important event, which is about leadership. As Eloise said, following the report of the Independent Panel, quite a lot of different work streams of reform have been embarked on, and we see negotiations for new legal instrument at the WHO. We see the work on revising the international health regulations. We see the work done on the Pandemic Fund to be hosted by the World Bank. We see the review of the access to COVID tools, Accelerator and COVAX. All of these are areas we recommended action on. But we made a very important recommendation about the need for a global leadership council for the UN General Assembly to be seized of the matter because pandemic issues go far wider than health. Central as health is, every part of society is impacted by a pandemic. And we see a need for leadership at the global level, just as the need was so great for it at the national level and the regional level to step up and deal with pandemic preparedness and response effectively. So thanks to leadership from South Africa, then joined by New Zealand, Costa Rica, Sweden, and a group of other countries, It was wonderful to see the UN General Assembly pass a resolution in recent weeks calling for a high-level meeting here in New York to look at the big picture, to give political momentum. So let's thank all of those who helped with that. And the idea is that the meeting will be held no later than this time next year in the high-level week. And the high-level week is quite a good time for getting leaders to high-level meetings. And the resolution says it should negotiate a political declaration which will catalyze and mobilize momentum for pandemic preparedness and response. And let's remind ourselves that we have gone through cycles over the decades of panic and then neglect with pandemic preparedness and response. We have so many lessons to learn out of this. You have to strike while the iron is hot to deal with them, to incorporate them, to get an architecture which will be more fit for purpose next time. So today, focusing on leadership, as Eloise said, our first panel is going to have two extraordinary leaders who've stared down pandemics. And then the second one, we will focus in on the global level of leadership somewhat more. So I'm going to ask Prime Minister Jacinda Ardern to come up and, well, it's not a virtual couch, is it? We're here in person. I'm so used to virtual couches and over the last So I'm going to start by asking Jacinda. Jacinda, before the declaration from the WHO on the 30th of January 2020, you know, ancient history now, that there was a public health emergency of international concern, would the possibility of a pandemic been on your mind and all the issues that you were dealing with?
It's a good question. I have and you'll recall this process yourself, Helen, in New Zealand when you first come into the very privileged and humbling role of being a Prime Minister. The Department of Prime Minister and Cabinet and the National Security Team come in and bring with them a list essentially of everything that could go wrong. And I think they wait till that point because there's no backing out. And there you are in the role. And the hazards register, which now we're working on making sure that these are more public and open registers. The hazard register includes on it a list of risks that New Zealand faces. And these will not be new to any New Zealander. Biosecurity incursions, the potential of volcanic eruptions, earthquakes, severe weather events. And on that list was pandemic. And I remember seeing that on the list, but I do not remember at any point it piquing my interest to the degree of the reality of everything else that lay in front of me, because everything else that lay in front of me had hit us in the last 10 to 20 years. So it was there, but did I anticipate it? Did anyone anticipate it to the degree to which it hit us? No, is my honest answer.
So Dr. Tedros declares this international emergency and, word comes out to New Zealand and the rest of the world, you better get ready. What went through your mind?
Do you know, prior to that point, and I think as you indicated, of course, at the point that the World Health Organization made that declaration, there had already been a call for it to be elevated to that degree. So by that time, we were, reasonably far along in the conversation. The first time that I saw or observed what was happening with COVID-19 was reading BBC articles about Wuhan during the summer. So that was the first I saw of it and processed it. Of course, at that time, our Ministry of Health was starting to gear up their system and observing what was happening. But just to give you a sense of timelines, of course, from that point, the declaration was at the end of January. The first case reached New Zealand on the 28th of February. And then from there, everything became incredibly compressed in terms of the decision making. It was high speed. At the point that I registered the concern, it was before the declaration, absolutely. But even then, very short timeframes. And I think that in itself tells us why all of this preparatory work is so important. Our level of connection, our level of movement as a nation, when we're reflecting on the last time we faced anything of this scale, well, in recent memory, many in New Zealand harked back to 1918, our level of movement and our ability to spread pandemics now is extraordinary. And so the speed to which we need to be able to move also needs to be extraordinary. And frankly, it wasn't.
So there was extraordinary speed, and I dug out the New Zealand Ministry of Health press release of the 28th of February a while back.
Yeah.
And it said, we have found the first case of COVID-19 in New Zealand. It's not expected to lead to a widespread community outbreak. Within 3 weeks, Jacinda had the country in a full lockdown. So tell us about the compressed period, because you know what I think was so significant about the New Zealand response was the captain stood up on the bridge and never got off it. Right? So tell us how you sort of took control of it with the whole of government leadership.
I mean, I think this is one of the things, and I've always been really careful about the degree to which we ever cast judgment on any other country's response, because there were so many things that are unique to New Zealand that I think allowed us to respond in the way that we did. That's not to say others can or can't or should have, shouldn't have, but I just feel like it's not for me to cast that judgment. So we're a population of roughly 5 million. We're geographically isolated. Now, that doesn't mean that we don't have a large inflow of tourists. We do, tens of thousands. There's a lot of movement in our borders. But on the 28th of February, that first case we picked up at the border. An individual arrived in New Zealand from a place where we had no border control. So there were some places that we weren't allowing arrivals because we were concerned about the movement of COVID. That individual was picked up at the border. And so when we said, you know, there's no risk here of community transmission, we had already built a fixation on the idea that so long as we knew where it had come from, we had some control. So it was a level of false sense of security, I think, in the beginning. Because as we were putting up our testing regime, in the beginning, we were only testing arrivals who were symptomatic. So because we were relatively limited in the resource we had for testing. And to be honest, that seemed to be the advice that was coming out internationally, connected to a border and a particular set of quite limited symptoms. But you're right, I remember the moment that we had a case where this person tested positive. It was a gentleman in the Wairarapa. I remember it. We could not connect him to the border. And I remember sitting with those officials that live in this small country. You can get into a lot of detail, individual questions, trying to, so he stays at a holiday park. Could he have come in contact with a tourist? We were desperate to find a link, because if we didn't, we knew it had got away and it was in our community. And so when we realized we could not link it, my heart sank. I knew that we had to move very quickly. So first case on the 28th of February, we were in lockdown within 4 weeks of that first case at the border. Yeah. So it was very fast, and it was within several days of that first community case.
And of course, not having had a pandemic on this scale since 1918, even before my father, who's 100 years and 6 months old, was born. So there's almost no lived experience of the pandemic in New Zealand, obviously. The architecture wasn't exactly fit for purpose, was it? You had to sort of invent as you went along, learn as you went.
And yet, even you think back to that period and you think, we've had so much, there's so many advances in medicine and science. And of course, during the pandemic, 1918, of course, there were, mistakes, incredible mistakes made that in fact would have heightened the speed of that transmission. But that flu devastated New Zealand, and it did so within a 6-week period. But when I looked back after the fact, there were doctors in isolated parts of New Zealand up in the north who you can read records of them closing off bridges and access points as a way of trying to stop the transmission. So there were the seeds of us understanding the very basics of pandemic management. But we, I think, assumed that these ideas of isolation were too arcane. Surely we can do better than this in the management of a pandemic. But in those early days where you know so little, some of those simple practices are going to be the most effective. But you can see there was a hesitancy over their use, but they proved to be so important in the early days.
I did read somewhere a suggestion that the German government, confronted with the virus spreading rapidly, actually went back to the records of 1918 to see what they did, because actually isolate and and test and treat is
Yes.
you know, it's
The
an old
basics.
trick, but it's the right one.
Absolutely.
So, you know, what really surprised you along the way then?
Yeah. Oh, every day we were learning. And I think as politicians, very rarely are you confronted with a problem that you're asked to solve where you have such incomplete information. And that's very confronting, because I think what sits in politicians' minds, our job is to give confidence, to give comfort, to lead with confidence, to give a sense of assurance to your population when that's what they're seeking from you. But we were having to make decisions on such incomplete information. So in the end, our view was we needed to just say that here is what we know, here is what we don't know, here is the very best decision we can believe we can make based on that. And what was critical there, I think, when you have such incomplete information, was being willing to bring in the experts. And here I just want to pay tribute to the scientific community and our health community, who without their expertise, the epidemiologists of which, you know, prior to that, New Zealanders are now extremely familiar with our nation's epidemiologists and our public health specialists. Without them, our response would not have been what it was. But being willing to bring them in, put them on, make sure that they were given the space to speak freely and openly about their knowledge and their views, which the media gave them that platform, and that was very important too. Without that, I think that we would have been really left wanting. And the final point that I'll make here, that when we have incomplete information, because we had a bit of a lag, you can hear that first case for us, 28th Feb, that was well after the experience of others. I have a chief science advisor. It's a relatively recent phenomenon in New Zealand to have a Prime Minister's science advisor. But having her, Dr. Juliet Gerard, networked into the international community of science advisors meant that she was often feeding into me what we were learning overseas really rapidly. Our epidemiologists and public health specialists were doing the same. We need to formalize that network, because that was invaluable. The open source sharing of genomic sequencing, of testing information and practice, all of that was to our massive advantage, but did not establish itself immediately, and in the future absolutely needs to.
So what about the global level then? I mean, you were obviously watching and seeing what could be learned from the responses of others. WHO was sending out guidance probably by the day. What do you think worked at the global level, and where do you see the shortcomings?
Yeah, so there were things there that were really practical for us. So look, New Zealand, of course, had an influenza pandemic plan. But what became clear to me right from the beginning is that everything that you need to do as a health community, as a government, is so specific to the individual illness. You need to understand, you know, the details of transmission. Are we dealing with, you know, respiratory drops? Is it as infectious as measles or as infectious as the flu? What's the incubation periods? Is isolation going to work if we have short or long incubation periods? Now, having experts who are able to provide us with that level of advice, the symptoms we should be tracking for, that was really invaluable. So having bodies for that purpose. What I noticed, so interestingly though, was when the WHO took a position on anything, we were then asked as a government to be accountable against that position. And that's a good thing. The WHO has said you should be doing X or Y. Why are you not? That's a useful device. The only area where that I can recall, there may have been others where we differed, was on borders.
No trouble.
And so when we think about creating that international network of leaders, I am interested in how we think about border surveillance and borders as a tool. Because New Zealand would not have been able to have the response that it had were we not able to manage our borders, but the WHO called for countries not to use border controls. Now, I for one share the view that we never want a situation where we seem to be discriminating against other nations, and it was framed as if I think you had an individual restriction that only applied to one country, I can understand that, but we universally took an approach on border management in the end. I would be concerned if we weren't willing to explore that as a device, because I think it did make a difference in slowing down that disease.
Yeah, and the international health regulations of 2005, of course, are almost premised around letting trade and tourism and travel continue unhindered. But, you know, there wasn't the global connectivity that there is now of people when those regs were written. So I think when the international health regulations are renegotiated, this is definitely an issue that needs attention.
Oh, and look, there are things that absolutely need to move unhindered. Consumables for, you know, the delivery of health protections and vaccination. There we learned some really important lessons. APEC in the end we used as a device to remove any trade barriers or supply chain constraints for PPE and vaccines. And that is a level of pre-preparedness we should have from now on in every respect. But a real question mark for me as well, though, on vaccine supply. Look, there'll be those who are much better placed to give you the ins and outs of how we need to improve the both the development and distribution. But I'll make one observation. At the moment, the equitable delivery of vaccine supply very much sits at the whim of pharmaceutical companies. They're determining who receives them at low or no cost and who isn't. Yeah. And that requires a lot of judgment to be made. And one simple observation that I have is that New Zealand, for instance, we purchased on behalf of and distributed, of course, at no charge. We distributed vaccine across parts of the Pacific. We talked to our neighbours and said, who's covering what? Let's make sure we've got vaccine into the Pacific region. We were purchasing those vaccines at a higher price than the EU. We're a small nation at the bottom of the world trying to do our bit. And yet we were being told that, of course, these judgments around the way that countries were paying for vaccines was based on level of development and status and so on. There will be lots of examples where that wouldn't have been the case. But those decisions, in my mind, need to sit elsewhere.
Yeah, definitely. I'm going to open up for people to, just explore any of the points further that Jacinda's made, because it's just an amazing opportunity. And David Miliband, I wondered whether you might like to pop anything to Jacinda from what we've heard, because David has been just such a stalwart on our panel of calling for global leadership and leaders to stand up. So,
thanks very much. Lots I could ask you about how to be successful in politics, which is a separate seminar, I think, than this one. First of all, thank you for extraordinary leadership. Certainly when we were on the independent panel, what you did and the way you did it was a tremendous inspiration, really. So thank you for that. I guess my question is to fit the COVID question into the broader question of how we manage this interconnected world. Because the truth is, as I see it, that risks are becoming globalized. Health security, nuclear security, economic security, environmental security, most obviously. But resilience is becoming nationalized, or is national or local. And what we struggled with, frankly, throughout the independent panel's work is it's one thing to say, let's one country learn from another country, because that's obviously a sensible thing to do. It's good policy. But these are global risks in a connected world. And COVID was a current and present danger. And obviously something like climate, for too many people, is a far away and an invisible danger. And so I would be very interested in your reflections about how to make the argument that not just that New Zealand needs to be well managed, learning the lessons of this crisis, but the global commons needs to be managed in an effective way.
It's a great question, and one I will try and answer briefly, because I think you could have an entire panel session on this. The one thing I would say is that one of my observations was that we were all so desperate to learn and talk to one another about how everyone was managed. It was this great leveler in that regard. And I remember having numerous Zoom interactions with other leaders where we were reaching out and saying, how are you dealing with border management? What are you doing on isolation requirements? How is your education system running at the moment? And you would find yourself reaching out to those who were akin to your response, who were doing relatively similar things. I remember talking to the likes of, I talked to everyone from, you know, those in Israel to Denmark, the Netherlands, we were scanning around talking to everyone. But one of my observations would be is that in creating an international ongoing response, whether it's preparedness or reactive, the global community will only be as successful as the lowest common denominator. And so if we are too focused, and I was having this conversation with the team earlier, if we are too focused on consensus only, I think that will drive down the level of ambition and response, and then we may fail. We may be no better off than we were previously. We just might have a better collective understanding that we're going to fail. And so how do we create those international networks that actually drive up ambition and drive up the minimum response that you see? And it may require us to think about arrangements beyond consensus alone. That would be just the first thing I'd say. If you bring those lessons over to, say, climate change, and your question there around how do you give that level of proximity to the issue that a pandemic provided, in the Pacific, the proximity is already there. I think, unfortunately, there might be a misnomer that climate is, and the effects of climate change are all about sea level rises, and that until you see the beach on your doorstep, you're okay. Pakistan's flooding is climate change at play. New Zealand has severe weather events, 1 in 100-year events happening every 2 years. We need to start making that direct connection very openly around the changing environment and experiences that people are seeing and having, so that we have that same level of proximity and urgency, because it is there right in front of us, as the pandemic was.
Definitely. Second row, you had a hand up. Yep. Yes.
Good afternoon, Excellency, Madam Prime Minister. My name is Ambassador Malik Abid, and I'm the Secretary General of International Human Rights Commission. First, I'm grateful to Pandemic Action Network for providing me this excellent opportunity to interact with you. 2 quick points. First of all, based on your experience of managing pandemic so successfully in your country, what one message you want to give to the rest of the leadership in the world to change or manage it more effectively, God forbid if it happens again? My second point is that, being an intergovernmental organization, part of the United Nations system, we would love to nominate you as the next Secretary General of the United Nations. No, I'm serious, Excellency.
Do you know what I'd say? Guys, you had your chance. That's what I'd say.
Because this is the time that the United Nations should use the female leadership, which is today have proven to be more effective.
Yeah.
So, am I right? Thank you. And last, thank you so much for mentioning about Pakistan. I'm originally from Pakistan. And whatever you see in the media or the social media is only 5% of the devastation. I just came back from Pakistan. 30% of my country is still under 10 to 15 feet of water. It's not just the floods. It's the food insecurity, it's flood. Now, the 30 to 40% of the schools in the entire nation are destroyed. We are going to face the bigger crisis in terms of education, insecurity. So thank you so much for your leadership. And definitely, we are going to nominate you as a Secretary General.
That is most kind, and I reiterate what I said before. The UN had its opportunity here, and I have a job that I love, that I'm very privileged to have. So to answer your question, what would I say to other leaders? I'm always very cautious about that, because we only have glimpses. We never understand anyone else's domestic realities. But the one thing I'll say about my reflection on COVID management is there was no perfect response and there was no easy response. I think in hindsight, and might be the case that we pan around and think that some particular decisions meant that you came through the pandemic pain-free. No one did. There were sacrifices made everywhere. And New Zealanders made a huge number of sacrifices. We're such a globally connected country. We love having people visit our shores. Such a significant proportion of our population either have loved ones overseas or rely on the ability to come and go. And so those border closures were really hard on our small country. And so great sacrifice was made, but we did that knowing what the alternatives might be. And so here, I think the major lesson for me is when you don't have full information, when you don't know what the trajectory is, take the option of least regret. And so I distinctly remember sitting around the table with the team, and experts were telling us, look, we don't know the trajectory of this pandemic, but there's a potential that you could lose more people than you did in World War II. And so in my mind, the immediate response was, we have to save lives. And so what is the best option for us to take to give us the best possible chance of saving lives and livelihoods? And look, either people will say you didn't do enough, or they'll say you did too much. I'd rather be in the latter category. Yep.
And many people are alive because of those decisions. That's the reality. Yes, someone's got their hand up halfway down the aisle there. Thank you.
Hi, good morning, afternoon, I should say. I'm Michelle Acorn. I'm the Chief Nurse for the International Council of Nurses, and I would like to thank you very much. Greetings from our board, Howard as well. Of course, the pandemic right now is the health pandemic, and as we talk about preparation, we need to think about sustainability when we think about investing in our health workforce right now. Leadership, education, service delivery, jobs as well. What is your best advice to invest in the health workforce for the health and social determinants for our future in terms of physical and mental health and sustainability? What are your best actions and how do we move this forward? Thank you.
Thank you. And I think everyone in this room would want to acknowledge our health workforce, particularly our nurses. And we are going through what I observe is a global shortage for that workforce. And I think that should give us cause for pause. Why is it that we're unable to attract the scale of workforce that we need in order to have both well-running and well-functioning health systems, but also to be looking after the mental health and well-being of our workforces, which are under considerable strain? So how have we got to that position and how do we fix it? In New Zealand, we're absolutely acknowledging that one of the issues has been making sure that we're remunerating appropriately our workforce. We're going through at the moment pay equity for our nurses, acknowledging that they are in a workforce where traditionally they have been paid less for gender issues. But that is only, I think, one part of the question. The other is how do we overcome barriers for training as well? In New Zealand, it's free. Your first year of post-secondary education and your course of choice is free. But we need to keep looking at every single barrier that exists in that regard. And the same for mental health. We do not have globally enough practitioners in mental health, particularly for children and young people. And one of the byproducts of this pandemic is now the impact on our young people's mental health and well-being. And that goes for New Zealanders as well. So we need to keep growing these workforces. And I'm not the expert to answer all the question as to how we've got to this place, but what I do know is that it's our responsibility to try and resolve it.
Fantastic. Next question. Yes.
Thank you. Neil Bora, I'm a physician with Conservation International. I want to thank both of you for your service. Prime Minister Ardern, you brought up the point about climate change. And we right now face a twin crisis where pandemics and climate change are in a, thank you. Pandemics and climate change are in a feedback loop with each other. As one happens, it increases the risk of the other and vice versa. But there's also certain international opportunities right now through the creation of a pandemic fund through the World Bank, and also a pandemic treaty that's being negotiated out of the WHO, where we have an opportunity for transformational change. So I specifically wanted to get your thoughts on inclusion of prevention of spillover within those two opportunities. That's an issue of equity as far as I see it, because the tools of preparedness and response, such as vaccines, are inequitably distributed. And despite best efforts, I still have concerns that no matter what, people in resource limited settings will always be the last to receive these tools. Whereas when we prevent spillover, everyone benefits, particularly people in resource limited settings. So what is your thought on including prevention of spillover within these tools? Because I think that's an issue that's falling through the cracks.
Yeah. Well, I would say and here it would be great actually to hear from Helen as well. Here I would say on whether it's pandemic preparedness or climate prevention, the cost of responding to these disasters will always be far more devastating and impactful than actually the preventative work. So let the lesson of the pandemic be prevention, both for future pandemics, but also on the way that we think about climate. Your issue or the question you raised around vaccine distribution or inequitable distribution, one observation I would make is around our part of the world. Those nations most impacted by potential health crises in the Pacific, they were not devastated by COVID-19. Onward travel and transit travel into the Pacific, I'm talking about the South Pacific here, and other parts of Melanesia, there were different stories to be told, but in our part of the Pacific, because transit routes came through countries that used border measures, we didn't see the spread of COVID-19 until they were fully vaccinated. And the vaccination rates in some of our Pacific nations was over 95%. If they had access to healthcare workers and the tools of the vaccine, they looked after their own. So the lesson I think to us there is what can we do to be enablers, and how can we actually demonstrate our collective regional responsibility? Imagine if every developed country was working so actively alongside developing countries, building them into their pandemic planning and preparedness, but making sure their own workforces were enabled, because shipping in workforce from other countries and something that requires trust and confidence is not a recipe for success in my mind when it comes to consumables or distributing vaccines. So that for me was a really key lesson from this pandemic as well.
And just picking up on the other P, prevention. If we'd had another year, maybe the panel could have been panel for prevention, preparedness and response. But you know, you're right. If we do the right thing by the world's forests, our biodiversity, we do the right thing by veterinary standards of the way, you know, meat is prepared and stop the illicit wildlife trade. These are all critical things to prevention before we even get into having to deal with the threat that may materialize. These zoonotic spillover events are coming at us very fast now, and any of them, I guess, has got the potential to do to us what COVID has done, which is why we at the Pandemic Action Network, and those of us still very active from the former panel, are saying the time is now to act. You know, the hour is late. This could be on us again. And let me make one last point on that, which is that we're probably worse off in a way now if we had to face the threat again, because countries have been stripped out fiscally of their space.
Yeah.
You know, it was tough on every country. Our countries had to borrow more than it's ever comfortable with, like every other high-income country. Low-income countries can't borrow anymore. They're out of space. So if you had to respond again, the way we've responded recently, it would be tough.
Yeah.
Right?
Yeah, absolutely. And one other spillover, interestingly, is we may now have the infrastructure for rapid vaccine distribution, but do we have the appetite amongst our population bases? Now, what's fascinating to me and worrying for me is what we observe with polio and the reemergence. In our country, the threat of measles to children is significant. And it wasn't that long ago that we dealt with a very significant measles outbreak in one of our low socioeconomic communities. And yet we saw vaccination rates for those population groups decline over the period of COVID for two reasons. We were so focused, obviously, on vaccinating our populations on COVID. And secondly, I worry that we've had increasing disinformation around vaccines as tools generally. Now, so there is work to be done there, because again, I think a possible spillover may be around how we deal with other infectious diseases where we have the tools already, but they're less willing to be used.
Well, this panel was about leadership. We've heard an extraordinary example of it. I want you to thank Jacinda, who must run as we all do. Thank you.
Thank you so much, Prime Minister. Thank you. Fantastic. We had a brilliant discussion there, hearing about those experiences from the front line. There's a few spare seats in the front if people at the back want to come and be a bit closer, shuffle down, there's good seats available. So we've just heard why leadership matters at the national level. And now we're going to talk about how that can translate to the international level. So it's my great pleasure to introduce our next panel, the Right Honourable David Miliband, President and CEO of the International Rescue Committee, former British Foreign Secretary and former member of the independent panel, Dr. Ayoade Alakija, Chair of the AU's African Vaccine Delivery Alliance, Co-Chair of the Access to COVID Tools Accelerator and WHO Special Envoy for the ACT-A, and Dr. Raj Panjabi, Special Assistant to the US President and Senior Director for Global Health, Security and Biodefense. Please come to the stage, and Helen, back over to you. Thank you so much.
So this is also another amazing panel, and we're going to get straight into it. And as Eloise said, lift from talking about the national level now to talking about the global level and not what needs to happen. So Ayoade, we're going to go first names, Yodi for short. We're going to come straight to you and say, what are the main lessons you've drawn from watching COVID-19 play out around political leadership at these different levels through the crisis? And what do you think needs to happen?
Thank you very much. And it is such a pleasure to be here. I just told former Prime Minister Clark that she is one of my absolute role models. And I've been called a rabble rouser, and apparently I'm in good company.
Exactly.
But thank you very much, the Pandemic Action Network and everybody who is here, and also my co-panelists. I think if the pandemic has taught us anything, it's that we need to stand together. And we didn't really see much of the kind of leadership that we needed to see in the pandemic. We just heard brilliantly from Jacinda, who really was one of the examples of incredible leadership during the pandemic. And you could see it, even as she spoke, you could see the heart, you could see the fact that she was concerned about people. We have a sort of alignment in the world at the moment, a nexus of climate, COVID, crises, conflict in various parts of the world, and we need as a global community to be prepared. The leadership issues that we have seen from the pandemic, if I go back to the pandemic itself, the lack of leadership under the former US administration and the UK government at the time, and I mean, some people can't say this, but I'm independent and I can. There were bad boys behaving badly at the beginning of the last pandemic, which we didn't see the sort of leadership we typically would have seen from the US and from the UK. I mean, I remember Ebola. I remember several other threats around the world where you would see the US. I mean, in Ebola, I was in Nigeria, I was in West Africa, and I saw what the US stood up at the time. And so the adults were absent in the room. There was not enough leadership from the countries that would typically lead in this regard. And eventually they were more focused on domestic national politics and putting economies first. And yet that failed. The failure to put people first had serious implications for the trajectory of the pandemic, because and I posit that had Tedros from Ethiopia been Ted from Colorado, they probably would have taken him more seriously. I think there was an element there, definitely, of institutional racism. There was an element there of, oh my goodness, this cannot possibly be happening and you cannot know what you're doing. And the world suffered as a result. What I was calling for at the very beginning of the pandemic was, it's very similar to what you referred to as a Global Threats Council, was that we needed to elevate this to the very highest level of political conversation. I had conversations at the time with the UK ambassador to the UN, Barbara, and many other colleagues that were sort of bilateral, informal conversations saying, look, we really need to get this to the top of the agenda. But there was a reticence. There was a reticence because the global leaders themselves, sort of the adults in the room, the big boys around the table, were being very, very themselves being very focused, and almost there was a denialism. So leadership, as we saw from Jacinda, women in leadership, of course, and I can't agree more with what the gentleman from HRC said, absolutely. You know, that sort of leadership that was people-centered, but also was high-level involvement. You heard her talk about her day-to-day interactions with her scientific officer. This is what the world needs in these times of crisis.
Definitely. I'm going to be very innovative here. I understand President Sirleaf has arrived, so I will give up my seat, move over here and stand as your moderator. No, I don't want your seat, no. And I'll leave that for Sirleaf. But David, let me come straight to you on the issue of the huge gap in global leadership, because you've been so articulate on this and in formulating the terms of reference in our panel for a Global Health Threats Council that could fill that gap. I'm going to throw this to you to set out what needs to be done.
Well, thanks very much, Helen. I came onto the panel as probably the person who knew the least about health on the panel. I remember when you called me up in September 2021 and asked me to join the panel. I pleaded to you that I didn't know much about global health, and you said that's okay. We're not asking you for that expertise. The point that I want to hello, Madam President. Hi, great to see you. The point I want to register with this group here for discussion and to answer your question, Helen, is that the biggest thing I learned in the course of the panel's work is that pandemics are not a health issue. They're a health issue and a political issue and a security issue and an economic issue and a social issue and a communications issue and an education issue and. In the course of the panel's work on discovering that, I remembered what General de Gaulle said about war. War is too important to be left to generals, because wars aren't just about fighting. Wars are about a whole range of other things too. Pandemics are too big just to be left to health ministers. And that informed my thinking as we tried to diagnose what an appropriate international response would be. Because by definition, the international response needs to be complementary to the national and local response, not substitutive of it. We formulated the idea of a Global Health Threats Council precisely to engage the minds of political leaders who were required to think across the piece, not just about health, and to think about trade-offs, to think about accountabilities, to think about cooperation, and frankly, to think about sacrifice, because that's an important part of this equation. And for me, the argument for a Global Health Threats Council is absolutely overwhelming if you want to live in a connected world that manages the global commons rather than mismanages it. You refer to the terms of reference that we developed for the Global Health Threats Council, which is complementary to the other bodies that exist. It doesn't substitute for the WHO's role. It's not a threat to the WHO. It's actually ballast for the WHO, which we argued separately needed greater financial and other independence from the woodworm of political vested interests. And it seems to me that the period since our report has more than demonstrated why we desperately need coherent global leadership, because we are not preparing for the next pandemic, and we haven't finished the business of addressing the current pandemic, either at global level or at national and local level. And my day job is to run the International Rescue Committee. We're a global humanitarian charity. Vaccination rates are less than 10% in most of the places that we work, and in some places less than 1% in the communities that we work in. And so I think the imperative is to take the pandemic issue out of departments of health and make it a genuinely pan-governmental effort. Just one final point. in the end, it's only prime ministers who can blow the whistle on their own systems and say, stop, we've got to do things differently. The department, is a famous British politician who said one of the diseases of government is departmentalitis. And it's only prime ministers who can overcome departmentalitis. And that's what we need when it comes to thinking about, in a strategic way, the management of what is a global risk. And I think it's very, very encouraging that countries as diverse as the US, I think Indonesia has signaled some interest. South Africa has been very outspoken. I think there's a potential global coalition of countries that could push this forward. I just want to say one final point. The most damning statistic in the whole panel's work was the statistic about the previous reports. I think in the previous 20 years, there'd been 11 quote unquote high-level panels whose recommendations had basically been ignored. And after Ebola, which you rightly mentioned, the Kikwete panel, President Kikwete, former President Kikwete of Tanzania, had recommended effectively a global health threats council. It was a rather larger body than we were anticipating. And if that lesson had been learned about the role of political leadership in blowing the whistle when things are going wrong, I think we wouldn't be in the mess that we're in today. So that's my argument for the Global Health Threats Council, which I think is as imperative today as it was then.
11 panels and 16 reports, I think, so largely gathering dust on shelves, but completely agree with you. And I think the way President Kikwete's report was handled was it was then thrown over to the UN system to discuss it and look at implementation. And the old story, you know, physician, heal thyself. The system doesn't reform itself, which is why it's critical that this is dealt with at the level of the General Assembly at a leader level to say, this is what we want. So President Ellen, my co-chair, my partner in crime, I think we could say at the international panel, along with David and others, President Ellen's experience is really unique because she stared down Ebola, and heaven knows what a devastating experience that was for Liberia, Sierra Leone, and Guinea. And I was privileged to go to Liberia in early 2015 when the hopes were just there of coming out of it and coming to recovery, and just got a sense of what Ellen had managed to do there. She brought all that knowledge to our panel and has, ever since we launched the report, been doing the hard yards, getting to New York, obviously more than I could, sitting behind barriers of travel in New Zealand. But she's been out there really promoting the panel's recommendations on what needs to happen at the global level. Ellen, what would you like to say, building on both these experiences, the national experience, which was just so incredible, and then what you brought to the panel and how you see the way forward on this global architecture?
Thank you, Helen. Let me first apologize for being late. I think we had a traffic threat this afternoon. Countries from the global south, like my own country, Liberia, have always faced health threats. For us, the many communicable diseases, the most important one in West Africa, for example, being malaria, even non-communicable diseases for which we've not had the national health system to respond effectively. And so you can imagine what it was in West Africa. I was in Liberia as president, to know what happened when we faced Ebola, a disease that we knew nothing about, had no idea how to respond to it. And there was no way we could get anything except determine how we were going to get support from some. But let me tell you some of what I call the key measures that we use to be able to address this threat. First of all, information. All we knew, because we had a health minister who had nothing to know, he did not remember the Ebola threats in the Democratic Republic of Congo many, many years ago, and didn't know anything about how to respond. And so all we knew were the messages coming from our rural, up in our far eastern rural area, that people were dying. And the first response, of course, on the part of people, seeing how drastic this was, a disease, and how people, they began to run. And to run across, run for safety, run toward the capital city where they thought they'll get much more safety. Our first information was information, reliable, timely information. How do we know what's happening there? How are they running? How can we enable them to move? Because at this point, the confidence in government had now been shattered, because people in rural areas felt the government was doing this to stay in power. And so, and what we did was to respond in exactly the manner was not appropriate, was to stop the movement of people as a means of stopping the transfer of the disease. And that brought again more difficulty. But we quickly found out that we had to do more than that. And so the communication to people so that they knew exactly what was happening, telling them the truth, telling them what they would face, what sort of responses we would be able to give, so that we could make sure that we could address this. Coordination among the different parties that had a part to play, whether it was the health or education or information and whatnot, ensuring that they all were speaking from the same page, that they could tell the same information. And so we held meetings, regular meetings. I chaired those meetings of all the persons concerned to make sure that they knew. And in order to have sure that we had the information right, that we had our communication in place, that we had our communication, we ensured that all key holders of the society were part of the response. And so in those meetings, they were all represented, whether they were religious group, or whether they were indigenous groups, or whether they were business groups, or legislators, or executives. They all had representatives there, so they were told exactly what to do. But with all of that, we did not have the means to respond. And so you need partnerships. We need somebody we could reach to. And what we did was, of course, we reached the United States, declared first partner of Liberia for help, and we reached our African Union. And the response from all of them, individual African countries, as well as African Union as a whole, even the private sector that mobilized a group of young Africans to come and work with our young people and to pair with them in trying to provide the type of movements of people to be able to address this. The US, of course, I spoke to President Obama, and he sent out people from the National Institute of Health. They took over. And because we had doctors dying, nurses dying, people dying, and people were dying not only from Ebola, dying because there were no access to health facilities. And they were afraid to go to health facilities for fear that they would be contracting the disease. And so this meant that we had to get something to help the doctors. And that's what NIH did. CDC was represented. WHO, of course, was represented, but in the early days, and this is where our real answers came. When it was predicted that 1 million of our people would die in a matter of a year, that's when we took over. And we decided that responsibility to save our lives and livelihoods rested in ourselves. And we gathered all of our local community leaders. We put responsibility in the hands of our community health workers. They took over. They were able to identify the symptoms, to respond as best they could, to report this to the health officials, to the health clinics, and then we really got it. But what does this all amount to? And there's one factor that you cannot say was not. The one thing was leadership. And I always say leadership comes not only at the very top, leadership comes throughout the society. Those who are willing to set example, those who are willing to do things, those who are willing to take action within the confines of their abilities and their means. And that's what happened with us. And our own people took responsibility with support, yes. And I did too. I ran out to every clinic to take supplies, to be able to meet with nurses and doctors to get them past their fears. And with the effort of everyone combined, I dare say, though we lost over 5,000 people, Liberia was reported to have fought Ebola in record time. But it took the effort of everybody working collectively. And so it follows that we didn't have vaccines for Ebola, but then COVID-19 followed. We had enough of the experience of Ebola. And when COVID-19 came, I think most African countries were more prepared for COVID-19 because we had had that experience. And the methods of relying on ourselves, beginning to rely on people in the frontliners. Raj will remember much of that because Last Mile Health, a group that he worked with, were also some of the first responders. And so with the pandemic, things changed. The report that was made that Helen and I, with the dynamic group of people that included David and others, had a report that was evidence-based, that had a very profound consultation process with civil society, with all stakeholders, with our scientists led the way with the research that they did in predicting what would happen if certain measures were not taken. Those measures were all reflected in the report of the independent panel for pandemic preparedness and response. And I believe David or others may have gone over what those recommendations were. Clearly, the first thing was to stop the pandemic, and the question about the Kikwete report was talked about. None of those measures were taken, but our report sort of built upon that in calling for collective action with those that would have the power, the authority, the political will to be able, and the diversity to be able to sit together and determine how do we do that. That's what the Global Health Threats Council was all about. And I think bringing together again, leadership at this level is an important factor of getting the right measures adopted through proper resolutions, through the General Assembly or whatever, and then making sure that there's some monitoring of it so that those measures are carried out at the national, regional, and global level and are monitored for implementation. And the other measures were also talked about, the strengthening of WHO. We believe WHO does remain the proper coordinating body for health threats and should have a responsibility. And I see no conflict between the work they have to do and the Global Health Threats Council. I can see a coordinated effort to be able to do that. We also talked about finance. No matter what you do, if we're not going to have financing at scale in responding to some of these threats at all these levels, then we'll never get the fullest effect. And so I believe that's what our story was. And we hope that this group will be the advocates, the ambassadors that will take this message forward. But at the end of the day, nothing other than being able to enhance the national healthcare systems that are the first responders. If we don't do that, all the global action, policy action will end up just being policies that never get implemented. Thank you.
Thank you, Ellen. Now, Dr. Raj, you work for President Biden, who's shown incredible leadership globally on the pandemic. And we note that Secretary Blinken has been leading with foreign minister counterparts and driving a global action plan. And I think they're due to meet. So tell us a bit about what the US is bringing to the leadership of trying to get all this right, get the global architecture right.
Well, thank you. And let me just check. Is the mic?
Yep, you're
Great.
on.
Well, let me just say, I think one of the things that the president has kept front and center is that we haven't done enough until everyone has access to the vaccines, the tests, the treatments they need. And while significant progress has been made on COVID-19 in the last year, some vaccine supply is no longer a challenge around the world, but vaccine delivery still is. Countries lack, as President Sirleaf said, the health workers or the community health workers or the training, the equipment to pay for those workers, the refrigerators, the clinics, the vaccination sites to deliver the vaccines. That is still vital. And we know it is because only a fifth of low-income countries have, in some low-income countries, I should say, not even a fifth of the population's yet been vaccinated. I think many of us could have predicted that was going to happen that have worked in these settings, that have seen the likes of malaria or Ebola, to know that those delivery systems have to be strengthened. So one of the critical things, and I see my colleague Mary Beth Goodman here in the room who's been working closely with Secretary Blinken, is doing this week, is to bring foreign ministers together as we have through the Global Action Plan, as well as that through the development minister level with USAID Administrator Samantha Power, and our health minister, Secretary Becerra, has also brought his counterparts together over the past several months to focus on action in specifically on COVID, trying to ensure that we get shots into arms, that we ensure that we are now scaling testing and treatment becomes available, which is still not available to us here, but not available around the world, inaccessible, and that we're looking at fighting and tracking the next variant and trying to put in place financing as well as capabilities to detect and respond to the next pandemic threat. And those three areas, focusing on the highest risk groups, the WHO has put forward that 100% of those who are ill, those are elderly, need to have their vaccinated. Healthcare workers need to be vaccinated as we chart towards more and more countries reaching the 70% national vaccination coverage target. That is a focus of our new global COVID framework that we launched last week, as is a focus on scaling integrated testing and treatment, access to those oral antivirals, and the testing that goes with it within primary healthcare systems, because we know, as was pointed out earlier by Prime Minister Ardern, polio or measles vaccinations have dropped off not only in New Zealand, but in other parts of the world, as has access to maternal and child health services. That has to be restored. And the third major area in our global framework is to ensure that we have a stronger global health security architecture, that we're also tracking and not underestimating this virus, which can throw new variants in the future at us, but also ensuring we have the financing in place to deal with those and future threats. And Secretary Blinken's efforts this week is to bring forward and rally the rest of the world alongside those lines of effort.
Fantastic. Let me open up for perhaps a handful of questions from the floor at this point. Of course, lots of hands have gone up, so we've stimulated interest over here. And please introduce yourselves. It's coming.
Thank you very much. I'm Isabella Marras from the United Nations Environment Program. I'm interested in in the issue related to science, climate change, the health, the pandemic. In a lot of cases, people don't trust science anymore. And that is, I think, something that also falls in the area of responsibility of leaders. How do we make sure that people trust science and then listen to what science says? Because in many cases, we could have avoided a lot of deaths and crises just by listening and acting based on science and not on, politics.
Our report actually commented that some leaders actively debunked science and built a distrust of it. So please, next one, we'll take them as a group. Thank you.
Thank you. My name is Paul Davis, and I co-founded Health Gap and was in ACT Up, or Partners in Health, and a bunch of groups. Right now, I work for the nation's largest group of COVID survivors on Earth. We're very supportive of a new pandemic fund, a new global fund for pandemics. We fought for it for 2 years. It's not perfect. We have a lot to say about that, but we're worried right now that by focusing solely on pandemic containment, what we do after an outbreak is this new fund that is much needed. It doesn't need to be yet another one of the things that left on the shelf, that is being set up for an expensive failure. It comes too late with buckets of fire to a conflagration that'll already be burning, when what we can do in addition is try to blow out the match. My question is this: containment is important. We need to stop the spread once an outbreak has happened. In addition, if there are cost-effective, proven, peer-reviewed, scalable models that steeply reduce the risk of spillover while paying added benefits in health, poverty alleviation, and climate, should these kinds of proposals be eligible for consideration for funding by the Pandemic Fund? If you would help us beat the drum for those kind of community-based solutions to stop outbreaks at the source at the community level before they happen, it would be awesome. Otherwise, the default position is to focus solely on stopping the spread and accepting that poor people just die.
Yeah, interesting question, and sort of came up with the question, I think, from the gentleman next to you in the earlier panel as well. To what extent should the Preparedness Fund focus on the prevention issues? Now, right down the back. Yeah.
We're going to go all the way.
Good afternoon. My name is Raji Tajuddin Mohammed. I work for Africa CDC. And just to share some reflection from the African continent. And again, thank you, President Ellen Johnson Sirleaf, just to say that the Ebola outbreak itself actually expedited the need to have the Africa CDC in place. Most of what we did during the COVID-19 pandemic was actually based on the lessons we learned from the Ebola outbreak in West Africa. And I think for African Union, the first ever response to any outbreak was during that Ebola outbreak. And going forward, Africa CDC came on board. Now, a couple of lessons from the COVID-19 pandemic from the continental perspective. One, we've been talking of political leadership. This is one of those areas where Africa CDC did focus on and allow us to achieve most of what we achieve as a continent. A week into the COVID-19 pandemic, we brought our ministers together, to channel the way forward on how do we respond to the COVID-19 pandemic as a continent, rather than going individually as one. I'm looking at it from just a national perspective. Number two, we also brought our head of state and government into the whole, response mechanism. In fact, during the COVID-19 pandemic, I think we're able to to discuss with our head of state on 18 different times so that they were able to provide that leadership. Number two, the issue of equity. Right from day one, we knew that there were going to be some issue of equity as far as access to those security commodities were concerned, because the past outbreak has demonstrated that the H1N1, the HIV, and so on and so forth. And with that experience, through the support of our head of state, we're able to put together a regional sort of a platform called the African Medical Supply Platform that allowed our member states equitable access to vaccines, diagnostics, and those essential supplies. Number three, partnerships. We also recognize the importance of working with different partners, like the US CDC, Raj and team were all very supportive in that. The WHO, the MasterCard Foundation, and so on and so forth. So all these contributed to what we did as a continent. So I think going forward for us as Africa CDC is just to recognize the importance of regional mechanisms, which fit into what David did mention, that we need to recognize the importance of national public health institutions, the importance of regional public health institutions, and the importance of those global mechanisms, so that at the end of the day, we recognize the complementarity between these three layers going forward. So for the discussions on all these global pandemic treaty, pandemic accord, and all those things, I think we need to also bring the voices from the regional level into those discussions. Thank you.
Thank you very much. I think because of time, I need to come back to the panel and invite each of them to pick up whatever they would like to from the three questions, and also to answer this question from me. What do we need out of the high-level meeting and the political declaration, which has to be negotiated within the next year? Starting with you, David.
I was looking forward to listening to my co-panelists to give myself some time to come up with some answers. Let me start with the first question. We won't all answer every question, but let me say something about the first question. I wonder if you're exactly right to say that it's the scientists who were distrusted. I think it was the politicians who were distrusted, who politicized some of the scientists. And in every ministerial or other job I've had, the community involved always thinks that everyone hates them. And I think it would be dangerous to accept that people hate scientists. I think it's that there's a politicization of science that we should be aware of, but we shouldn't misdiagnose the problem. And I think that there's no single answer to it, obviously, but my instinct is that when we looked at the countries that had done the best job at explaining to their own populations, the voice of the scientists was allowed to be independent and clear. And it was the cross-pollination that then led to allegations that the science was being used for political reasons or to justify political ends. And so I don't mean to dodge the question, but I think to frame the question rightly is important. I do think this relates back to the Global Health Threats Council, though, because part of the argument we made was peer pressure amongst politicians. And at the political level, and there was a very interesting point made in the previous segment before you arrived, President Sirleaf, by Jacinda Ardern, saying she was being confronted with WHO guidance, and her response was, well, either we're agreeing with the guidance for this reason, or we're not agreeing with the guidance for another reason. But that was a perfectly healthy part of the accountability that she had. And in the end, the science as well as the politics involves trade-offs. And the more transparency you can have around those trade-offs, the better. Just a final short point to the gentleman's question about the Pandemic Investment Fund. I'm a great believer that we mustn't let the best become the enemy of the good. And a Pandemic Investment Fund cannot solve every health problem. And the purpose of it was to fill an obvious gap that has emerged in the health financing system, which was around preparedness, including at the regional level, which I think has been underinvested, and in terms of speed of reaction, because we diagnosed that the period between January the 31st and the end of March, I think you called the February the lost month, Helen. Speed of response is important for the pre-filling of the Pandemic Investment Fund, because if you're not, speed kills in this, and if you're not on the front foot quickly, you're going to lose. So I hope that's helpful.
I'm going to come to Ayoade, then Raj, and then give President Ellen the last word. So Ayoade.
Thank you. I think the questions really have largely been answered. I mean, about the pandemic, the fund, I think the proof of the pudding is in the eating, and we will see that, but we do need some kickstart money that is available, and it's early days yet, so that's my comment on that. I want to speak more to your question, Helen, and to your point and why we're here. We also mustn't forget that not all threats are health threats, which was pointed out before. President Sirleaf just mentioned traffic threats just now in jest, but we have a multitude of threats facing us as a global community. So from my perspective, the proposal for a high-level sort of threats council sounds like a natural progression, building on from our existing structures and amplifying the existing approach. However, we must be sure that it also addresses the underlying flaws in the system. What would that look like in practice to respond to challenges? Would it include the voices of those from the global south? Would it include the voices of people from Liberia, Ibadan, Delhi? Would it include CSO voices, a diversity of voices? Would it include people from all communities? Would it convene just in New York or in Geneva and therefore exclude many people? I mean, just coming into New York for me this week was traumatic because I was taken aside and grilled for an hour as to what I was coming to do here. So we have to remember that the transaction costs for those of us who come from the low middle income countries of the world are high. I speak also from personal experience in that I am sort of co-chair and I'm special envoy with the ACT-Accelerator now, but I'm the only one on the ACT-Accelerator that looks like me. There needs to be more people that look like me. It's a lonely, lonely place to be. It's a lonely place to be the one who is constantly pushing against those who don't mean anything by it. They just don't understand. You don't know what you don't know. I speak often in local language, my local language, Yoruba, because also language is culture and our culture is important and we have been put in the language and the culture of the West. But if I want to speak in my language, I will say, as I said the other day, that in town, let's say, it is the person who's wearing the shoe who knows where it is hurting their feet. So we need a threats council and those who represent a threats council to, yes, we need the leadership, but we also need the advisors to be those who are close to the communities, like President Sirleaf said about the people who were sending messages from far away, from border towns, so that you understand exactly what is going on. We need inclusive leadership. We need inclusive institutions with the courage to reach beyond the boundaries of existing corridors of power, to expand who is at the table and who is not, to expand who swims and who sinks, to expand the voices of those who live or who die. We heard the other day from an article that there is the Politico article that talked about the 4 institutions in the world who control global health, who control this world. I don't want to comment on that article, but I want to comment on the fact that the reason an article like that existed in the first place is because we have a flawed system. And so will a global health threats council help us to address that? We need more independent voices. We need independent thinkers. We need to break the incestuous dynamics of a system that shuts out fresh, new thinking and stifles creativity and innovation. All of these are incredibly critical to reimagining a better world. So I support a threats council, but I support a grassroots fed threats council. I support a threats council that will convene in Abuja, Nigeria, that will convene in Delhi, India, that will convene in Malaysia, that will not just sit in New York, where within those corridors of power, where people really are the reverberations and the echoes of those of us who, and I am a health worker and I have been a frontline worker, who understand what works. I want Fiji, my other home, to be included because they are facing the threats of climate, and I lived through Cyclone Winston. So yes, we need a threats council that is multifaceted, that is multi-layered, and that is truly and properly inclusive, and that is not based in any of the power structures that are from the post-1944 Bretton Woods institutions that look like Europe and sound like Europe or the US, but we need more that look like me, that look like you, that look like you, that look like all of us. And for Mama here, that look like this incredible presidency of women that we have witnessed here today. We need more women in power. So if your threats council can be 90% women, I'm on board.
We'll put that in the terms of reference. Raj, quick comment from you.
Sure. Let me answer my friend Paul's question about the pandemic fund at the World Bank and the focus on community-based solutions. We should be investing in those communities because outbreaks start where? In communities. And where do they end? In communities. It's also, that's true everywhere. But it also turns out so it's the right thing to do, but it's smart to prepare, prevent, respond to outbreaks at their source. And that happens through communities as well. So to put it's not our mouth where our money is, and not just money where our mouth is, one of the things the United States has done is to release a set of priorities that we think the fund ought to focus on. And let me just say the primary issue has to be focus. It has to be impact. It has to be delivery. Otherwise, it will not receive the financing we need. And let's just be clear, about $1.5 billion is not what was called for. $10 billion is what was called for.
Yeah,
A year, thank you, a year. So, but for us to get there will mean this has to deliver impact. And so one of the things we've done in this position paper is to articulate, if it's going to focus on surveillance as an area, for instance, it can't just be labs and genomic sequencers. It has to be involving door-to-door community health workers who are part of their community and not some outside group that's coming in to look for the high consequence pathogens, but the ones that are hanging the mosquito net up, the ones that have the birth planning going on in the community, the ones that have brought the contraceptives to the community, the ones that already have the trust, the lived experience, and the expertise of the community. Because that is, as President Sirleaf said, what worked in Ebola. It's what's working in malaria. It's what's working, has worked in COVID. The countries with the greatest acceleration vaccination, with the biggest vaccination campaigns like India, or the greatest acceleration in some of the countries with the lowest income like Rwanda, have again invested in hiring, training, and equipping these workers. So that just has to be a focus. And I invite you to look at that and see if there's more we ought to be doing. To your question, Prime Minister Clark, about the role of the high-level meeting, let me first say we're just grateful to all of the fellow member states that put that forward. The United States was proud to join the high-level meeting UNGA resolution. I think that you're asking what I think what a wish list would be. It would be a diplomatic foul, I think, if 3 weeks into just this being passed, if I were to state what we would like. But I can say there are a few questions that need to be raised. First of all, to my sister's point, Ayoade, here about representation. This cannot be simply a meeting, perhaps, of just high-level leaders when pandemics affect communities. So in addition to ensuring equity in gender representation at such a meeting, making sure that we're asking questions like civil society and what is their role in such a meeting, ensuring we're asking about frontline health workers and what is their role at such a meeting, as one set of questions. I think the second is, how can such a effort catalyze ideas like the high-level leaders body that you have, the panel has put forward? President Biden, Vice President Harris echoed support for such a body. We have had, again, through our State Department, understood there's some mixed reactions to the specific form, but there is, I think, a lot of alignment around function. And whether it's ensuring a group is cross-sector, so it's not just the health sector. I think we've heard that reaction. That's a principle that I think ought to be considered. Another is that this has to facilitate high-level political engagement. How can we make sure such a high-level meeting sustains that, not just for meeting, but for a long time? I think the last one, question that ought to be considered, and the U.S. will be happy to take part in debating the agenda that needs to be set, is thinking about whether or not a global pandemic preparedness plan is something we all ought to get behind. Preparedness is not something we do once, it's something we do every day. We build muscle by using it, as doctors like to say. And this is a muscle, as we heard from Prime Minister Ardern, as we've heard from both you and President Sirleaf today, that has to be exercised every day. So we have a few components out there. We have the IHR and the pandemic instrument, which are our legal and normative components. We have the potential for a leadership body like the Threats Council or something equivalent. That is our potential political effort. There is the technical normative leadership that the WHO puts forward. There's the R&D capacity that CEPI puts forward. There's the ACTA or the future ACTA type mechanism that would help with distribution, procurement, allocation. And then there's potential for this new pandemic fund to make a difference. There really has not yet been something that pulls all of those pieces together and ensures that they add up to something that can take on the pandemic threat. So I think that's another question we ought to ask. The United States released an American pandemic preparedness plan a year ago. We've asked Congress for $88 billion for that plan over 5 years, treating it not just as a health threat, but a security threat that it is. And we've asked for the kind of funding that's there for the military in terms of the form of the funding. We have not been always met with the kind of response we want. But what I mean to say is it wasn't just a plan in name. It has numbers behind it. Could there be such a potential global pandemic preparedness plan as an outcome of such a meeting?
Sounds to me like a great list of questions to be putting to those who are going to negotiate. President Ellen, you've got the last word.
The message that is coming from the grassroots, from those who feel the effect of these threats. The message to the leaders of this world: we are tired of meetings.
Yes.
We are tired of talk. Be guided by the scientists so we have the evidence. Listen to the people and their priorities and act. That's all.
We can't beat that as a rallying cry. Eloise, please come up and thank our panelists and bring us to an end.
Thank you so much. Well, can we just hear it for our panelists, please? And our amazing moderator. Round of applause for Helen. Thank you all so much for coming. That rallying cry can't be surpassed. We heard today that leadership matters, but there's something else that matters. Advocacy matters. This network in this room, whoever's on Zoom, whoever's keyed into all of the organizations here, if we pull together, if we rouse our voices and we actually ask all of these governments to do this, to deliver a Global Health Threats Council, to get behind the high-level meeting next year, to maybe have a process coming out of that where we have sustained accountability for actions, not words, such an important point, then we can do it. And we have to do it because we must, because we don't have a choice. We have to stop the madness of paying for response and not investing in prevention and preparedness. And together we can do it. Thank you so much. It's so wonderful to be together. And we hope you stay for 15 minutes at the back. There's food and drink. And if you're not a member of the Pandemic Action Network, why ever not? But you can come to us and join, and we'd be delighted to have you. Thank you.
Flying out Saturday night.
Are you back to New Zealand?
See you direct flight.